Hello and welcome to Basic Spanish for OT, PT, and SLP. My name is Juanita and I will be your host. I am an occupational therapy assistant as well as the author of this book, Basic Spanish for OT, PT, and SLP clinicians in the acute hospital setting. This book, as well as the ebook, can be purchased on Amazon.com. I will post a link in the channel in case you need to get a copy of the book. On this channel, we are actually working through the book, and the channel, the ebook, as well as the book, was set up to assist therapy clinicians with basic phrases and terms, words that can be useful when working with Spanish speaking patients that may have a difficulty with the English language. So, with that being said, vamos a empezar. Let's get started. So, on page 52, today is the continuation of the last two videos in which we did the body. We were actually working on the body, el cuerpo. So, if you haven't seen video one or video part two, you may want to go back and look at that, or you can start here. That's fine as well. So on page 52 of the book, we are starting at the top. And remember, I did this book in a alphabetical order in English, and then I'm teaching you to say it in Spanish. Okay, so let's start. Nose, nose, la nariz, la nariz, la nariz. Pancreas, el páncreas, el páncreas, el páncreas. Penis, el pene, el pene, el pene. Rib, la costilla, la costilla, la costilla. So I'm going to take a second here just to go to remind you again. La is singular, but if we're talking about more than one, we would add las. So the feminine version of costilla is las costillas. Okay, so that's important for you to know when you're talking about more than one rib. Scapula, la escapula, la escapula, la escapula. Shoulder, el hombro, el hombro, el hombro. And I will take an opportunity to stop here. So this is considered, the noun is considered masculine. So el hombro, but if you were talking about both shoulders, los hombros, los hombros, los hombros. And I've said before, I did not finish the book so that you can finish the book. So the things that you want to think about is learn the term first, and then learn how would I say that if I'm talking in plural. It's important. Okay, the next one, skin. La piel, la piel, la piel. The next one is spine, and definitely as therapy clinicians, we are always talking about the spine. Okay, so la columna vertebral, la columna vertebral. I'm going to say it again, la columna vertebral. I'm going to give you that one more time. La columna vertebral. Okay? All right. Spleen, el vaso, el vaso, el vaso. Stomach, el estómago, el estómago, el estómago. Tendon, el tendón, el tendón, el tendón. Thigh. El muslo. El muslo. El muslo. Throat. La garganta. La garganta. La garganta. Thyroid. La tiroides. La tiroides. La tiroides. Toe. El dedo de pie. El dedo de pie. El dedo de pie. So remember, if you're talking about more than one toe, it would be los dedos de pie. Los dedos de pie. Los dedos de pie. Tongue. La lengua. La lengua. La lengua. Tooth. El diente. El diente. El diente. And if you wanted to know how to say teeth, what would it be? Los dientes. Los dientes. Los dientes. If you thought that, then you're correct. All right. Uterus. El útero. El útero. El útero. Waist. La cintura. La cintura. La cintura. Wrist. La muñeca. La muñeca. La muñeca. And I'm going to stop here again. Sometimes in Spanish, the word for one thing is also the word for something else. So you can have la muñeca could be the doll. That's another word for doll. But generally in therapy, we would not be talking about dolls unless you were working with children. So those who are pediatric therapists, if you're working with children, you may hear la muñeca as well as la muñeca for the wrist. You will hear it also for a doll. Okay, so that's a word that has two meanings. Vagina. La vagina. La vagina. La vagina. And the last one is vein. La vena. La vena. La vena. So that's it. If you've gone through all three videos, you have gone through all of the body parts that are we commonly use in a hospital setting, or if you are in a skilled nursing facility, or if you're a therapy clinician, or even if you're a nurse or a CNA. Those are generally some of the common body parts. It's not all of them, but it's the common ones. So with that being said, that's it. Thank you for coming by. Gracias por venir. And I will see you in the next video where we continue with treatment words. Treatment words. Adios.